Well, you have likely heard of an athlete suffering from a torn rotator cuff and thought, well, it's just part of the job. But these injuries are far more common in regular adults than you may realize, affecting more than 30% of those over the age of 60. It's a lot. So what exactly is happening? How can you fix it? I am happy to welcome in Dr. Scott Smith. He is a surgeon with OrthoNeuro, the sponsor of this segment. Dr. Smith, thanks for being here.
Thanks for having me.
All right, so let's get kind of an anatomy lesson on this, right? What is a torn rotator cuff? What's kind of happening in that area when we hear about this?
Sure. So the rotator cuff are comprised of 4 tendons that form a covering over the ball of the shoulder joint. And they're integral and responsible for helping us lift our arm and use our arm in space.
Okay, so when we talk about the tear, what is it that's happening?
So usually what happens is the tendon degenerates over time in the vast majority of cases, and that leads to pain and oftentimes a feeling of instability within the shoulder, particularly difficulty with raising the arm. And incidentally, significant pain at night seems to be a really major issue with folks with rotator cuff tears.
Yeah, and when you're interrupting the sleep, I think people get a little bit more frustrated with an injury. And we hear a lot the term tendinitis. Is that the same as this? Is that a different injury?
So it's kind of the same disease process, but in a spectrum. Tendinitis is just inflammation of the tendon without physical damage to the structure of the tendon. Oftentimes it can present in very similar fashion as a rotator cuff tear, which is part of our job to help figure out what exactly is going on.
And I will say, you know, I talk about the athletes that get injured. They may actually like feel a tear, but does everybody kind of know that that's what's going on? Do you often have symptoms, or can it just present itself if you're...
Well, interesting enough, the vast majority of people out there have some degree of rotator cuff tearing, depending on their age, and they may not even know it.
Yeah.
Usually for the vast majority of people, there's no injury. It really just kind of is a gradual process over time where they have increased pain and dysfunction with their arm.
Is it often because of age? Is that what we're seeing?
Absolutely. As we age, our body's ability to regenerate damaged tissue becomes decreased, as well as the blood flow, particularly in certain areas of the body. The rotator cuff seems to be one that most people notice because of the uniqueness of the shoulder and how we use it on a daily basis.
And is it something that, you know, when we talk about sports that people play, not everybody's a pro athlete and does that kind of repetitive use, but a lot of people, you know, golf or play tennis or swim, and I feel like those are probably all things that you see that when people do that over time, it causes some issues.
Absolutely, and there's absolutely an increased incidence of this in folks who do a lot of heavy labor, repetitive lifting type activities. Is far more common having symptoms with that type of work.
All right, so let's talk treatment options. First, we'll start, are there some conservative ways that you try to treat this?
Absolutely. The vast majority of people with rotator cuff issues can be treated without surgery. The mainstay of treatment for this is typically some form of rehabilitation, physical therapy. Oftentimes, people with pain, they don't use their shoulders like they're supposed to, and that causes increased strain on the rotator cuff. So part of the therapy process is to basically retrain people how to use their arm. Oftentimes we focus on medications as well to keep the pain down, and occasionally injections are a part of the treatment program to help decrease pain as well.
Exactly, and you're holding obviously a model of that, we should point out.
Exactly.
And so is that showing where the tendons are and how much kind of is affected by that?
Exactly. The main tendon that's typically affected is the top tendon called the supraspinatus. And people with that type of pain often have pain more on the outside part of the shoulder, sometimes radiation all the way down to the elbow.
Okay, so it could cause big issues. What about surgery? When is that needed? Is that something that's possible?
Sure. Surgery is necessary for one, when conservative things have failed, and two, predominantly if the tear of the tendon is full thickness. Studies have shown that when the tear is full thickness, it is more likely to progress with time, and so we usually like to intervene earlier rather than later, because a smaller tear is much easier to repair than a much larger tear.
Okay, I imagine so. And so what about the outcomes for this? As far as even the conservative methods, do people get a lot of you know, success with those before moving on to surgery?
Absolutely. Over 80% of people are able to be treated without surgery. Surgery is really safe for if the tear is large or if they've failed conservative treatment, if they're not happy with the result of the conservative treatment. Yeah.
Then they can go forth and get the surgery. Okay,
Exactly.
so let's talk OrthoNeuro. You have offices surrounding, you know, Central Ohio. Where can people find you, Dr. Smith?
Correct. I am at the Pickerington office, New Albany office, and Grove City offices every week.
All right, there you go. We know it's orthoneuro.com. You want to check it out on the website and find a location near you. So thank you for being here.
Thank you.